So welcome everyone to this special Ask the Expert Q&A session organized on the occasion of Myeloma Awareness Month. As part of our Faces of Myeloma campaign, we have shared powerful stories from patients and carers throughout the month. Today, we are taking it a step further by addressing some of the most important questions we have received about living well with myeloma. Here with us is Ellen Waters, Myeloma Information Specialist at Myeloma UK, an MP member organization. Ellen, thank you for being here and for helping us to shed light on the key challenges myeloma patients and their families face.
No problem at all. Thank you so much for inviting me.
Well, living well with myeloma means a lot of things: navigating treatment side effects, returning to work, maintaining social relationships as well. So we'll cover all these aspects during the Q&A. So let's dive into the first question, which is related to fractures and the fear patients have from falling. So how can patients manage the fear of falling and the risk of fractures?
Yes, that's a good question. And it is one that we get asked quite commonly on our helpline, the Myeloma Infoline. So, of course, myeloma patients are more at risk of fracture. And that can be a scary thought when you're diagnosed with something like myeloma. I think a lot of the answers around this are kind of common sense answers. Let your team know of your concerns. And you should be aware of any areas that have been damaged by myeloma-related bone disease. And, if you've been given a walking aid, for instance, or any other aids to help get about the house, do use them. Try to think about the area that you're living in and keep areas free of clutter, for instance. And that's just common sense. If you're getting up and moving about and there's things on the floor that you don't maybe see, just be aware that they are trip hazards. It's also quite important, I guess, to keep muscles toned. Toned muscles help to support bones. So if you are able to do some regular gentle exercise just to keep those muscles toned, that's important too. But you will be guided by your team who will know your situation, who will have access to all of your scans and x-rays, and will be able to give you a bit of specific guidance around your circumstances. If you feel that a referral to an occupational therapist or a physiotherapist would be helpful, do speak to your team again and ask if that would be appropriate. They can provide support, they can provide further aids about the home to help you with those day-to-day practicalities.
Well, thank you very much for that answer. Fatigue is one of the most important challenging symptoms in myeloma as well. So what practical strategies do you recommend for coping with it daily while maintaining an active lifestyle?
Absolutely, yeah. Fatigue is something that we talk about every single day. It's a huge problem. And it's sometimes something that patients are a bit loath to mention because they worry that maybe treatments will be stopped and they don't want that, especially if it's working. And fatigue is a very individual thing. Some people do have fatigue that can be overwhelming, and others don't have very much fatigue at all. And every patient will know their own body well. And they may get to know, for instance, if they do experience fatigue, when that's going to be worse. Some patients tell us that their fatigue always feels worse after lunch or it's worse in the evening. So it's important, I guess, to plan activities around that. So if you know you're going to be fatigued in the afternoon or early evening, plan your activities for during the day. Of course, fatigue can have a physiological cause. So generally, once the myeloma is brought under good control, fatigue caused by myeloma usually improves. And the fatigue caused by myeloma is often down to anemia. So again, it's important to let your team know if your fatigue is new or not getting any better, or in fact getting worse. They will just want to double check that you're not becoming anemic or there's not a cause to your new fatigue. And fatigue can also be treatment-related side effect. So your team will take it very seriously if you're complaining of new fatigue or fatigue that's not being managed, and might decide to look at the treatments that you're on, maybe to reduce the dosage. They wouldn't necessarily stop any treatment. That's not a worry, but they might tweak things somewhat. So do be open and honest about how you feel. And what I always say is never ever suffer in silence. Fatigue is very common. Your team will have heard about this before. It's something that they will have dealt with on a number of occasions, and sometimes supportive care can be helpful. But it's important that your team knows, because if you don't say anything, they'll assume that you're getting on with your life very well and not experiencing any of this.
Yeah, it's important to speak up and make your doctor know everything that is happening, right? And the same, I guess,
Absolutely.
with other side effects that they can come with the treatment. For example, like diarrhea or constipation. So how can patients better manage this symptom?
Yeah. So gastrointestinal effects like diarrhea, like constipation, are quite common again, and they can be either due to the myeloma or as a treatment-related side effect, or they can be unrelated. But no matter the cause, it's important that the team knows to determine what the cause is and to treat it effectively. For instance, just to give you a few examples, constipation is commonly caused by high calcium levels. So if you are telling your team that you're newly constipated or that you've got constipation that you've not experienced before, they'll just want to double check that you've not got too much calcium sitting in your blood. Hypercalcemia, as it's called, is something that will be monitored for on a very regular basis. With diarrhea, diarrhea can be as a result of an infection. And patients with myeloma are very susceptible to infection. And if you're in and out hospitals, there are certain infections like C. diff you might have heard of that are going about and that are easy to pick up. So your team might just want to double check that you've not got an infection that's causing the diarrhea. So they might want to get a wee sample and send it away to the laboratory just to check that you're not dealing with an infection. Diarrhea can also be caused by, for instance, lenalidomide. Or Revlimid is one of the IMiD drugs in myeloma, and it can sometimes cause this issue called bile acid malabsorption. Now that can cause diarrhea, and it's not something that's sometimes the first thing that somebody thinks of, but it does happen. We speak to patients all the time who have been on lenalidomide or Revlimid for some time and who do start to experience diarrhea due to this bile acid malabsorption. It's quite an easy fix with bile acid malabsorption. Sometimes it's just a case of reducing the fats in your diet. Sometimes it's just a case of taking a supportive medication to help matters. So it is really very important. The other thing with diarrhea is that if someone is having diarrhea on a regular basis, and even if they're feeling sick too, and actually being sick, then there's a risk that they can become dehydrated. Being dehydrated is not a good thing. It can really make you struggle, and it can make your kidneys struggle. So if you have got some diarrhea, speak to your team, but try and keep your fluid intake. Even if you don't feel like eating very much, try and keep a good fluid intake, unless you've been told otherwise by your doctor. We would often say that 2 to 3 litres of fluid a day is recommended, and especially if you've got diarrhea. But do let your team know. They will want to identify the cause of any constipation or diarrhea, and they will want to treat that cause and offer supportive treatments as well. And it's also worth bearing in mind that sometimes constipation can also be a sign of diarrhea, or diarrhea can be a sign of constipation. It's a bit like overflow diarrhea. So the team will want to do further tests and investigations just to determine what's going on. Again, never ever suffer in silence. If you've got some gastrointestinal upset, let your team know.
And in fact, talking about diarrhea, you mentioned risk of infection, which is my next question. So myeloma patients undergoing treatment face high risk of infection. So what steps can patients take to minimize that risk? And how can carers manage their concerns about transmitting viruses to them?
Yeah. So patients with myeloma are always at risk of infection. They will always be considered to have a weakened immune system, be immunocompromised. That's slightly less of a risk when their myeloma is under good control and they've got stringent remission or plateau. Then their immune system will be probably about as robust as it can be. So the risks for patients is more likely when they're newly diagnosed or relapsing when their myeloma is particularly active, and certainly when they're on treatment for their myeloma, especially the very intensive treatments like stem cell transplant or the combinations of 3-4 combinations of anti-myeloma treatment. It's important to know the signs and symptoms of infection. There's lots of publications out there that can tell you what the signs and symptoms of infection are. For instance, if you've had a bit of a cold and you start to feel very poorly, you're coughing up any sputum that's a horrible colour, let your team know. If your temperature is high, if it's above 37.5 or 38 degrees Celsius, again, your team will want to know. It's so important that patients who do have an infection get treated with antibiotics. And sometimes they need to have those antibiotics in an intravenous way, so in a vein in the hospital. So knowing the risk, knowing the signs and symptoms, and avoiding those who look as if they do have obvious signs and symptoms of infection. And again, this is where the carer comes in. So speaking to family members, don't come visiting if you've got a cough or a cold. Don't come visiting if you think that you've got any sort of infection at all. And it is really important to keep up to date with all of your vaccinations. Now, we know that vaccines aren't 100% effective, but some protection is better than none. So make sure that you're up to date with all your vaccinations. Again, especially post stem cell transplant. And again, it's important that those that live in the house with the patient are also up to date with their vaccinations. Some patients do worry that, if there are children about, for instance, who are getting the live vaccines, that there may be a risk of transmission. It's a very, very low risk, or it's called viral shedding. It is a very low risk, but if you do have someone in the house who's getting a live vaccine, can you just avoid very close contact with them, and just know your own body, take your temperature regularly, report to the team. The team will be doing their job. They'll be keeping an eye on all your healthy bloods. And in particular, the one that they'll be keeping an eye on is a type of white blood cell called the neutrophil. That's a very important one for protecting us against infection. So your team will know a little bit more about just how robust your immune system is. So you are being looked after, you are being supported, and it's up to you to speak out with any concerns that you have, for sure.
And now we'll move to a different area, which is especially important for those diagnosed at a younger age, so work active. So what advice do you have for myeloma patients who are actively working?
Yeah, I mean, obviously my advice comes from a UK perspective. I don't know about the processes in other European countries, but I know that in the UK, for instance, a lot of patients do decide that they want to continue working. A myeloma diagnosis doesn't necessarily mean that you do have to stop working, although it can bring some challenges along with it. Whether or not patient decides to give up work completely or to go part-time or to change their job, for instance, if they have a job that involves heavy lifting, to change it to something else, is entirely up to them. So it'll depend on a number of factors which are specific to them, of course. And I think that because many of the treatments for myeloma are in tablet form, some are given as quick injections, it is possible to continue working, but you may have to bear in mind that there may be times that you do need to take some time off work to attend appointments, to attend for treatment, or if you're feeling poorly. So it's possible for patients to continue working if that's what they want to do. Some people decide that it's time to take early retirement or to retire through ill health. And there may be support around that from someone from the social work department, for instance, to be able to guide them around how to go about that. So that's very important too.
How can someone navigate the conversation when sharing the myeloma diagnosis with family, colleagues, but also with their employer?
Yeah. It is a worry, and the patients will often worry about how that will be taken when they do speak to their employer or the human resources team, HR. I think sometimes the situation is not as bad as you would first imagine. So mostly we hear that employers are pretty supportive and will do what they can to make your workplace environment a good one for you. Um, so when they're aware of the situation, they can make certain adjustments if necessary. Make sure that your chair is comfortable if you've got a bad back, for instance. Make sure you have some flexi time. Make sure that if it's possible and appropriate, that you can work from home if that's what would suit you better. I think it's often a good idea to speak up early and to be open and honest with your employer. I know that here in the UK, for instance, employees do have certain rights, and an employer, for instance, can't fire you for being for having a cancer diagnosis. That's just you're not. They're not allowed to do that. But you have to work together. It has to be a collaboration. So if you're open and honest with them, I would like to think, and I'm quite sure that they'll do what they can to make sure that you can continue to work if you want to.
In fact, it's not only about being fired or the fear of being fired, but also the concerns about being treated differently at work after disclosing this diagnosis, not only by the employee, probably colleagues as well. So, what advice would you give about
Yeah.
this topic?
I mean, you don't have to tell your employer that you've been diagnosed with myeloma. You don't have to tell your colleagues. I mean, the patient will know what's best for them in that situation. Um, but the employer does have to be able have to make reasonable adjustments if you want to continue to work. I think it takes time for these things. It might be a case of starting off by saying something, like, you're attending hospital regularly. You don't have to tell the full story. You can gauge how it fits in with your individual day-to-day living. If you've got a good relationship with your employer, with HR, and with your colleagues, yeah, absolutely. You might want to just sit down and have a good conversation with them about what's going on and how that will mean things will be different for you in your work life going forward. But gauge that and I think just speak up early, be open and honest if that's what you want to do. But as I say, you don't have to you don't have to say anything, but it's often a good idea to not take anybody by surprise. If they know that you're dealing with this situation day to day, then the adjustments can be made.
And probably same can happen not only at work but social relationships. So that balance between openness and talk about their conditions, maintaining privacy and boundaries can be kind of challenges as well. So how can patients balance this openness about their condition while maintaining privacy?
Yeah, yeah. And again, the patient will know their loved ones, their families, their friends better than anyone. And again, the fear of the conversation is often worse than reality. Um, Sometimes you might be surprised at how your loved ones will react. It can be kind of difficult, I guess, speaking to children, for instance, and depending on their age. But there is lots of support out there to help you with that. And there are publications that can give you some hints and tips about how to approach that. Again, it's sometimes a good idea to be open and honest. I've heard on infoline calls before when patients haven't told like a teenage child or a young adult that they felt excluded from conversations, and they only, you'd be surprised, they only really want to help. So if you've decided that this is a conversation you want to have with loved ones, it's a good idea to do it in an environment that you're all comfortable with. So a place and a time where you're not going to be interrupted, for instance. Maybe if you're all used to sitting at the dinner table and have a conversation after dinner, bring it up then. Um, Give a bit of a warning shot across the bows, if you like, just to prepare the person for that there might be a bit of a difficult conversation happening. So say something perhaps like, and you'll know best how to approach this as a patient. Say something like, well, you know, I've got some tricky news to tell you, and I would quite like to have a bit of a discussion about the news I'm going to tell you and what's happening in my life at the moment. So being open and honest with those you love is really important. And I think it's also a good idea perhaps to have some backup from publications there. Myeloma UK provides a whole range of publications for patients and their loved ones. So maybe have your myeloma and introduction there. And if you have those lying around on the coffee table or at the dinner table, people can pick them up and put them down when they feel like it. They can read as little or as much as they need. They can access the website. They can even call me on the helpline. I answer the helpline with my colleagues Fern, Haley and Rebecca, and we speak to lots and lots of patients and loved ones every day. We have an Ask the Nurse email service. You can signpost your loved ones to that, just to get some information, some clarification and some support. That's absolutely why we're here and why all patient organisations are here for sure.
Yeah, and as you say, it's important to have those information from patient organizations. We have patients working with them who knows exactly what they are feeling at that moment. So it's important they go to Myeloma UK and read all that information. And the same with all MP members across Europe. They can provide information in their own language as well and talk to them about different pieces of advice about all these topics. Um, Also, talking about relationship that we have, how myeloma can impact those relationships at home. Uh, how does myeloma diagnosis typically impact personal relationship? But what strategies can help maintain strong connections? And also, how roles can change after diagnosis? For example, younger myeloma patients who might be caring for parents or raising kids.
Mm-hmm. Yeah. No, things can change. Your life before the myeloma diagnosis is not the life after a myeloma diagnosis, not just for the patient, but for everyone involved, really. And it can be quite hard to adjust to that. And it can be quite hard to come to terms with that. But that's why there are organisations like Myeloma Patients Europe, like Myeloma UK. We're here to help you along that pathway. We're there to help support you. We're here to help give you the information that you need to come to terms with things. So yeah, I would suggest that use these services regularly, and you know, it does take time, but you will start to get your head around things. And by becoming informed allows you to kind of take control back. A lot of patients say that they feel that they've lost control. Their life is now a round of attending hospital appointments, being treated, thinking about myeloma, knowing about side effects. So information is power. So become informed and know what you're dealing with, know what questions to ask. I think if you're a bit better informed, then you build a better rapport with your medical team. And it is a two-way thing, that it is a collaboration. Gone are the days when it was doctor knows best and doctor's in charge and you do as doctor says. Nowadays, and I would like to think it's the case for everywhere, it is patients are asking questions and the team are answering them, so that there is a bit of a collaboration and a rapport there. And I do sometimes think that carers have it a bit harder, actually. So not only are they dealing with the impact of the diagnosis, they're dealing with fielding calls from other family members. They're dealing with becoming knowledgeable about a cancer they've probably never heard of, as has the patient. probably never heard of it. And they're dealing with making sure appointments are kept. They're dealing with making sure that side effects are reported. And they will keep a bit of a diary of appointment dates, of contact details. So carers often feel a little bit overwhelmed that that they've got so much to take on. But I often say on the phone that the patient is very lucky to have a carer who does all of this for them, because that means that they become informed and knowledgeable, so that the patient can get on with dealing with the diagnosis and dealing with being treated. So having a good loved one by your side is invaluable, really. And most patients tell us that they get through that because they've got such a good support by their side.
Yeah, the role of carers is very important. It's key, I would say, in myeloma and all cancers, not only myeloma. And sometimes carers feels that they don't have the right to complain, or they don't have any kind of needs, because the most important thing is the patient. So how can partners and close family members support a patient without feeling overwhelmed themselves?
Yeah, yeah. No, it's important that they get support too, and they have every right to be asking questions. Um, there is a lot of support out there for patients, and there's also a lot of support for carers. I think sharing lived experiences is really important, and for both patients and carers. But there are support groups for everyone to attend, either virtually or face to face. And we do have specific support groups for family, friends, and loved ones where patients don't attend. So they're given that they feel free to be able to talk openly. And that's why our helpline, the Myeloma Infline, is important too. They can carers can talk about their loved one to someone who's not directly involved, and they feel a bit freer to be able to do that. And they open up. And it is such a valuable resource, honestly. And you probably understand this. Overwhelmingly, the feedback about the helpline, the Myeloma Infoline, is very, very positive. And you can almost sense a carer's anxiety just falling away from them. So there is support out there. There's peer support. For instance, we have our peer service at Myeloma UK, where we have patients who talk to patients. And we also have carers who talk to carers, and they're trained volunteers who are either carers themselves or patients, and they can share their lived experiences, which many do find extremely helpful. One-to-one sessions over Zoom or on the phone, vitally important. And it is so important that carers feel that they're supported and their needs are being addressed too.
Yeah, that's very important. And in fact, I have the two last question of this question is about carers, and probably they are both related one to each other. So, caring for a loved one with myeloma can be physically and emotionally demanding. So, what advice do you have for carers to protect their well-being, and also how can they balance their own needs while providing support to a loved one?
Yeah, it is a balancing act. It really is. And a lot of carers tell us that, their focus is the patient and their needs. Their focus is making sure that the patient attends their appointments, takes their medication, reports side effects. But it is so important that they feel that they're able to escape from that a little bit too. Not, not for long periods of time, but to have their own hobbies. We not just support groups and about myeloma, but something, completely unrelated. Go to the gym, go out for a walk in the countryside, get some air, clear their head. So it's really important if they can continue to maintain the hobbies that they had before. A lot of them are put on the back burner and aren't looked at anymore. But there is the opportunity to continue with your hobbies, or even to get new hobbies, or hobbies together. But yes, it's important that carers do have their own space and time away, so that their waking thoughts and their going to sleep thought isn't the patient and myeloma. It can be overwhelming when that's all you think about. day to day, from the minute you get up to the minute you go to bed. It's not a healthy mental place to be. So get away out and get on with your hobbies, walk the dog in the countryside, or do something nice for yourself. Really important.
If you don't take care of yourself, obviously you cannot take care of others. So I think it's very important also to think
Exactly.
about ourselves to be able to help others, right?
Exactly. Yeah. No, absolutely. And I often say that, if you become unwell, if you become very poorly and need treatment, and your anxiety is overwhelming, then the patient isn't getting the support that you want them to have. So look after your own health, physically and emotionally. It's so important.
Yeah, thank you very much, Helen, for all your responses. Not sure if you have any final message or any comments to give to myeloma patients watching this video.
Oh, I mean, myeloma is such an individual and such a complex cancer. And as I said before, often the first time anyone hears the word is when they or a loved one's been diagnosed. And then it becomes a bit of a roller coaster of becoming knowledgeable, of attending hospitals, doctor's appointments. So it can be an overwhelming time. And organisations like MPE, like Myeloma UK, are there to support you. So please do use us. That's absolutely why we're here. And as I say, the feedback is overwhelmingly positive. People do get a lot from talking to someone else, from being sent publications, from emailing someone that knows about myeloma, because we're knowledgeable about myeloma. It's the first time they've heard about it, probably. So yeah.
Yeah, it's important that they go into the Myeloma UK website, MP, and other organizations to find the right information. And if they don't find the right information, they can always ask us, and we will provide that. So thank you very much, Ellen, for helping us answer some of the most important questions from myeloma patients and their families about living well with myeloma. A big thank you as well to everyone watching this video. Make sure you keep an eye on our social media channels for information and upcoming videos with myeloma and EL amyloidosis aspects. So thanks for watching.